Hello, good evening, and how are you? How you day? Welcome to another session of Ask the Doctors. The program holds every Sunday by 8 p.m. Nigerian time. My name is Dr. Frederick Unwibohai. I'm a licensed medical doctor, and on this platform, we teach, we answer questions. If you have any medical condition, we always encourage you to go to the hospital and see your doctor. You understand? You're welcome. I'm live on Facebook. I'm live on YouTube. I'm live on LinkedIn. I'm also live on TikTok. So if you can hear me, I want you to tell me where are you watching me from. Happy Sunday. Now, today's program, we will answer your questions today because I noticed that a lot of people have been asking us questions. A lot of people want to ask questions. So I just said, okay, today let's take some of your questions and answer them on the program today. So if you have any questions for us, please ask. But remember, we will not treat you. You will go to the hospital. First come, first serve. So if you are watching this program and we have ended, I'm sorry. Sorry, we might not respond to you. But right now, if you're watching the program and you are live with me, let me know. Blessing on YouTube. Good luck, blessing. How you doing now? How are you? Abigail James. Happy Sunday, Abigail. How are you? Let's see. Let's see. Yeah, yeah. How you doing? Okay. Festus. Yes, Festus. Good evening. You're correct. Carigiana. Carigiana. How are you? Yeah, Mr. Festus. You're correct. Joy. Joy Izitura. Good evening. Good evening. Good evening. Welcome. 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 So share this video, and then if you have any questions, if you get any question for me, ask. I go try. My co-host is Dr. Israel. Dr. Israel will join us very soon. So ask now, quickly ask. Ask, man, see. Good evening, good evening, good evening. Welcome, welcome, welcome. So share. Oh yeah, now. Yes, if you get questions for me, Mas, see what are questions they quickly. Good evening. Isaac, Isaac, I greet you. Mr. Adamu, I greet you. Ask your questions. Isibo, Antonia, I greet you specially. Adebayo Abbas, good evening, sir. Hawa, Hawa, how are you doing? I just do. George Moses, good evening, Mr. George. Destiny, good evening, good evening. Olutayo Alabi, good evening. Good evening, Doc. Can question come from medical side? It's like you're just watching today. This question is medical, medical. But if you want to ask something that is not medical, well, you can still ask. It's a question and answer session. Yeboah. So if you get any question to ask, uh, doctor, please, when does a child carry the DNA of the father? Right from fertilization. Good luck, blessing. The moment the man meets the woman and the man release and he fertilize, from that period, the pikin don't carry the DNA of the father. So the mother and the father together. Hmm? What will I do for body itching? There are many things that can cause body itching. So you have to find out wetin dey cause your body itching. Is it your cream? Is it your environment? Is it water? Is it something with your skin? Wetin be your name, Mr. Peter? Is it something inside your body? Is it liver? Is it kidney? Is it skin issue? Is it cream? Is it chemical? So many things can cause body itching. So you have to find out is it insect bite? Many things. Good evening, Chinedu. Can ulcer be cured totally? Yes, ulcer can be cured totally. Ulcer can be cured totally. Some people are very stubborn. They want ulcer to be cured immediately, immediately. It will take time. You know, they cure fast, fast. You have to be patient. Another one be say some people no get ulcer, but they go dey talk say dem get ulcer. The only way to know whether you get ulcer, now when you do endoscopy, they go put something inside your nose, into your from your mouth or the nose, the mouth, yeah, into your stomach to confirm if you get ulcer true true. So yes, ulcer can be totally cured. What causes sore throat and body itching? I don't do video now. Sore throat. You know they watch my video. Mercy Abubakar. I have made a video on sore throat. Many things can cause sore throat. In your environment, allergies, infection, stress from the voice, viral infection, flu, bacterial infection can cause sore throat. Please talk about seizure, causes, precautions, measure, and solution, please. Well. I will try when I have the chance. I will write. I will take note of that. I will take note of that, and then let me see. My pen is here, so let me just try and document this one down. Since you say make I talk about seizure, but I noticed that when I make video, una no dey share, una dey like to dey do gossip. Huh? So let me document this one down. Seizure. Yeah. And then I will plan for it. You know I'm a busy man. Not be only content I dey do. I work. Ehen. I get all that thing. So I will try. No vex, no worry. Good evening, Usman Mohammed. Keep sharing. Let me take a question from TikTok. Let me take one question. This person know they follow me. Why? You know they follow me. Who is this? Let me take one question from TikTok. Is it possible for a child to be AA and the parents are AA and SS? No, it's not possible. Full stop. The parents cannot be AA and SS and the child be AA. No, it's not possible. All the children will be AS. Full stop. There's no AA anywhere. Let's see. Okay, good evening, Kobayat. I see you. How are you? Mr. Sunday. Good evening. Everybody share this live session. Make I see whether I fit answer question. The difference between itraconazole and fluconazole. Why are you asking? Are you a medical personnel? You can read this one. You cannot explain. I beg, I cannot explain this online. Yeah, no vex. Hmm? Itraconazole, fluconazole, ketoconazole, they are all in the same family. Sure, you understand? The same family. It's just like Nigerians, Lagosians, Yorubas, Igbos, Hausas, Edos. You understand? They are all Nigerians. So itraconazole, fluconazole, ketoconazole, miconazole, they are all in the same family class. This is the best I can do for you online. This is not a pharmacology class. They are in the same family class. That is what it means. But if you want to know more, then you'll go read pharmacology textbook, but it go hard you. People on TikTok, how far now? Yes, keep liking. Let me see. Let me see. Let me take one question on TikTok again. Please talk about how to revive people under such attacks, seizure, fainting, asthma. Well. I will try. I will try. I will try. Okay. Keep sharing. Uh, okay. Dr. Israel is in the house. Let me bring up Dr. Israel. Just that the people on TikTok, una no go see my guest though. Dr. Israel, good evening. How far now? How you doing? Hello, Dr. Israel. Can you hear me? Okay. So you can, Dr. Israel cannot hear me. Let's take some more questions. Let's see. Let's see. Okay, let me go back to Facebook and YouTube. Dr. Israel Alpha, happy Sunday. How you day? Hello. Oh God. Okay. Make you join me. Dr. Israel, join me. Your network. Like say make we use, let's see.
It's
Okay.
fine. The network is fine. I was mute. Sorry, I was mute before.
You muted your mic. Oh yeah, now happy Sunday. How you day?
Yes. Same to you. How far now? How your side? I cannot hear you.
Can you hear me now?
Yes, I can hear you now.
Okay, you can hear me now. Okay, very good. So maybe try, maybe they very fast. The questions too plenty. The questions are plenty, eh? So somebody is asking a question on Facebook. He says, I always experience heartburn at my chest and back to the extent it causes my hand to hurt. After taking omeprazole as prescribed, it does not go away. What causes it? At times I sleep under fan to feel cool.
Okay, we not go fit know wetin dey cause am like that. Is for you to go to the hospital, meet your doctor, and maybe your doctor will be able to tell us what is causing it. Eh? You may be asked to do some investigations, and those investigations I go come let the doctor know wetin really dey cause am. Yes, some of those things fit not even be wetin dey think say e be. Eh? E fit be something different or something worse than that sef, or something simpler than that. Because when you dey take drug wey no be the right drug, e no go work for you. So when you go to hospital, your doctor can actually let you know wetin e be, and e fit tell you what you can do.
Okay. Let's see. Okay, let's go to the next question. The funny thing is that let me go to TikTok. These people are not sharing, but they ask me question. They are not sharing the live session, but they are asking. Maybe when they are ready, we'll come back to them. Um, okay, let's see. Let me take one question on TikTok from somebody where they follow us. Let's see. This person is Mabel. Mabel, they ask questions. They say, what causes high protein? High protein.
um High protein, depends on the diet wey you eat. If you eat protein, a lot of protein diet, you go get protein for where, first of all.
Okay, yeah. So, Mabel on TikTok, when you say high protein is not anything. What causes high protein? High protein where? Do you understand? Somebody could just say within they cause high protein. You cannot just ask because that question is totally not even complete, no, not correct. You have to make your question correct so that we go know how to respond to you. High protein where? You get the point. So that one will help us know how to respond to you. If you never share this live session, Omo, share. Oh. My network is very bad. Hey, yeah, sorry. Okay, let's take this question. Is there bad worm that causes miscarriage in early pregnancy? Ah, Dr.
There's
Israel.
there's no bad worm, anything. There's no bad worm, anything that causes miscarriage in early pregnancy. Most of the time, pregnancy is divided into three trimesters: the first, the second, and the third trimester. Now, in the first trimester, if there's any miscarriage, most of the time is hormonal problem. It's about the body. The body notice say, oh, this pregnancy not dey grow well, e no dey do well, so the body go remove am. So that's what happen in most of the early pregnancy. Then in some cases, e may be say most things has happened na cause am, not be just um not be just the hormone or any other thing. E fit be say something else has happened. People that have malaria during pregnancy, they can have that. You get some medication wey you take when you not suppose take, fit still cause those miscarriage and all that. Yeah, so no be any worm. There's no worm anywhere that's actually causing miscarriage for early pregnancy miscarriage.
Okay, I think this person, somebody don't tell and say now worm they cause miscarriage because no doctor, no
Yes.
licensed, no licensed medical doctor. Because it gets some people too where they online where they call themselves doctors and they are not medical doctors. So no licensed medical doctor go tell you say na worm nine cause your miscarriage. Nothing like that. Okay. So share this video. Share. How can person treat hernia? Hernia can only be treated by surgery. Bernard, there is no other way you can treat hernia except through surgery. There is no other way you can manage hernia. Don't allow anybody deceive you. Huh? Except through what? Through surgery. Okay. Uh Somebody's asking a question. Maybe try it very fast. My urine is foamy, and after a few days, it becomes normal again. What can the reasons? What can be the reasons? Oh God.
So you ask yourself those times that is foaming, what are you taking? That's another question. What are you taking? If you are taking things that makes like you are taking a lot of alcohol and all that, your urine may just be foaming during that period. Yeah, and when you say some days it is foaming, some days become normal, may just still be that it's your mind, it's you that is looking at it like it's foaming. And in those days, maybe because the urine is coming very much, you're having a lot of urine that period. Another thing, if you think say anything dey happen, just go do investigation, go and check your kidney function. When you go hospital, make the doctor ask for those tests so that you go see doctor wey go interpret the result for you when the result come out. Dr. Fred.
Yeah, thank you. This question, whenever I see this question, it dey pain me, but more will take him. He says, my wife is pregnant and she's I think always vomiting and she doesn't eat at all. She always what? I think this is she always is it throwaway spits? This is not how to spell it though. What can she take? Mr. Amy Don. This question most times this question we'd always tell you say carry your wife go hospital. If your wife get belle and your wife dey vomit, she no dey fit chop, make doctor see your wife. No go collect anything on internet and give to your wife, so that they no go affect your wife or the baby for her belle. Your wife needs to go to the hospital and see a doctor. If e dey very serious, very severe, they go admit your wife for hospital. But this habit wey you dey find medicine on top on top internet to give to a pregnant woman, because I don't know if you are a new follower, but if you do am again, we suppose arrest you. So that may you no go put the woman life at risk. We suppose arrest you. I'm saying this to let you know, say na very serious matter. Abeg, make sure say a doctor see your wife quickly. Um, okay. Abeg. Uh, oh my God. Doctor, can bleeding ulcer lead to angina or affect lungs? Can bleeding ulcer lead to angina or affect lungs? Good evening. What do you even understand by angina, Mr. Wetin be your name, Mr. Israel? Do you know what angina is? Do you know wetin dey cause angina? Because if you know wetin be angina and wetin dey cause angina, then you no go ask this question. So make your question clear again. No dey try give a complex question wey maybe you sef no even know. So rephrase your question and ask again because your question no look like wetin get head. No vex. Unless Dr. Israel get the clear picture of your question, but bleeding ulcer lead to angina or affect lungs. No. Please ask well, yeah? Who be this? Do hernia get solution without surgery? This is hernia. This is not how to spell hernia. Una no dey watch my videos. Okay, maybe you watch the video, you no watch the full video, it's on the page. There is no solution for hernia without surgery. Dr. Israel, you want to say something about this?
Yeah, the first thing is wetin be hernia, and that one go first ask the person. Now that one the person need to first know. Now hernia is just an opening. It's an opening in that place. Come dey make the some of the structure inside the belle or inside the body dey pass through that opening. Dey pass through that opening. So when you dig hole, normally when you dig hole, what do you do for that hole to cover? You need to cover the hole. Maybe you fill am with sand to cover the hole. So in human body when there is a hole or a opening. Okay, for your cloth, if your cloth tear, when hole open come dey, what do? You take it to tailor, make the tailor sew am. Dem no dey say make the cloth come by itself join back together. Na so e still be for the body. So once there's an opening, you no go fit say make we go take one medication or make we wait make that opening cover. No, you go need to go cover am so that make e no cause more issue than good. So that's hernia. Hernia is just an opening. So the only treatment for that is to go cover that opening so that may nothing dey pass through there again.
Okay, make I go TikTok. The people on Facebook, they know they share. So make we leave them. Make we go TikTok first. Because these people on Facebook, they know they share. Maybe when they share the live session, maybe we will come back. But let's take question on TikTok. Let's see. So we have a question from Blessed Musa. It says, how to lose weight and belly fats. How to lose weight and belly fat. How to lose weight. Losing weight is number one, it's hard work, it's discipline. Number two, you have to find out wetin really be the cause of your own weight gain. Is it lifestyle? Is it na your lifestyle? Is it genetic, family? Is it something wey you dey do? Is it medicine wey you dey drink? First of all, find out. E go help you, because if na genetic, at least e dey your family, that one na different. If na lifestyle, wetin you dey do, wetin you dey chop, you go need to stop those things. You go need to exercise. You go need to reduce the food so that make everything work together. You go need to also try to go gym. You go also need to get a dietitian to help you. If na medicine, e get some people wey dey take some kind medicine like steroid wey dey cause am. You all go need to stop am. So this thing to cut down on weight no be one way, na different measures you go need to put together. In addition, you go also need to know wetin be your BMI, that is your body mass index, so that e go guide you when you dey lose the weight. You no go just talk say I wan lose weight. Wetin be your BMI first, so that when you dey lose the weight, you go get a goal and target. Dr. Israel, want to add anything to that?
No.
Okay. People on Facebook share. When you share, we know that you are supporting us. If you know they share, you know they support us. We have another question here, Dr. Israel. It says, please, I'm having waist pain and I have been in so many hospitals, and my problem has not what? My problem has not, is it stopped? I don't know. You want to respond to that?
Okay, now, I don't know if it's a lady, if it's a woman, if it's a lady that is having the waist pain, the next question will come be how old is this lady? Don't give birth. If you don't give birth, what you take give birth? Na surgery or na SVD? And then another question, another thing, na which kind of work you dey do? How your bed be when you dey sleep? All those are many questions wey your doctors go ask you before they go even know wetin dey do you. And another thing is that they may even send you to go and do X-ray or CT scan to be sure of all everything concerning your waist and your back. Now, back pain or waist pain no be wetin dem dey treat overnight. No be wetin dem just give drug and you go overnight. Some of them sef no dey go. Except you modify your lifestyle and come dey take some medication, do some exercise and all that before you may even have relief. As I said, most of them no dey go 100%. So if your doctor even fit give you something when the pain take dey reduce you, and e come tell you make you go dey do physiotherapist, make you dey see physiotherapist, I think he has given you the best. Then if you be man, you need to also check some other organs for your body. Mostly that one still depend on your age. If your age don go far, you don dey elderly, you need to dey check your prostate and all that, because that may just be the issue why you dey get the waist pain. So many things dey wey you need to do based on who
Hmm?
you be, your work and how you sit
Hmm?
down for your chair go actually need to change
What?
for you to be able to manage that waist pain. So I mean, not think say na only medication wey dem go give you na im go actually treat you. No, you need to do all these things compassing before, yes, you go to manage your waist pain. Yeah. Thank you, Dr. Fred.
Okay, thank you. Let's continue. Let's be fast on Facebook. Can fibroid decrease after menopause? And the answer is yes, because when a woman enter menopause, all those hormone where they make fibroid grow, they go down, they go reduce. Therefore, the fibroid should go come dey reduce. So when the woman enter menopause, most times, the fibroid go down, and they no go disturb the woman again. Yes. Let's see. Let's take some more questions. Good evening, sir. Please help me with heart attack and kidney stone. Help you? How? How? Help you? How do you mean to help you? What do you mean by help you? You want to treat heart attack and kidney stone? Mr. Isaac, you have to go to the hospital. If you have heart attack and kidney stones, you have to go. If you want to understand heart attack and kidney stones, the video is on the page. But if you are having heart attack, if you are having kidney stones, and, and you want treatment, my guy, you go enter hospital. You go see your doctor, make them check you. Huh? Okay. Yeah, we know they here for that. We are not desperate. We are not looking for patients. However, some people still won't follow us talk. Okay, no problem. There's a way out. Look for the link on the page. But we are not on the internet to be looking for patients, looking for customers. No. Capital, no. Sure you get, I beg. So that the reason why we are online, you know why. Hmm? Okay. Um, Good evening, doctor. I feel pain when I poo poo. What could be the cause?
Sometimes there are some things when we say we suppose do within ourselves, we will know the reason why it dey happen. So the first question I will go ask is how is the stool the way they come out? Is they very hard? Is they very strong? If it dey very strong, that's the cause. That's the reason why you're having the pain. Because if you dey eat food wey dey make your stool dey very strong, you no go fit dey pass soft stool. If you no dey drink water, many water, or you no dey eat food that contain roughages, oranges, vegetable and all that, your stool will be very hard. Or for some persons wey okay, yeah, your stool will be very hard. So other things wey fit still cause pain in that anal region, maybe you get um hemorrhoid wey don dey injure. So it can also cause pain when you dey pass too. So these are some of the few things. But first thing first, na your stool. If your stool dey strong, you will always be having pain when passing the stool. um
Let's take this question. This person has been here. Maybe try see. Let's see. It says my period was supposed to start on August 23rd, but I haven't had any flow yet. I've been experiencing cramps and brownish discharge. I had unprotected intercourse on 26th of August and took a pregnancy test, which came back negative. I also had a blood test done, which also was negative. What can I do? Dr. Israel, you want to respond?
Okay, your period was supposed to come on the 23rd, but now you are seeing just brownish discharge that you don't let me assume you don't think it's foul smelling. Or if it's foul smelling, you for right hand there, you are having cramps, which is showing that yes, you are supposed to be seeing your period, that aspect. And you knack around 26th, which, well, that's after your supposed menses to come. So for me, I think today is now you have done pregnancy test and nothing is coming showing, and you may likely go and do some other investigations. But you need to see your doctor, a gynecologist. How old are you? That's another question. How old are you? You need to see a gynecologist, and because it depends on the age, you go say depend on wetin dem go tell you wey dey cause the menses not to come. And also for you to be having those brownish discharge and cramps, That's another reason why you need to see your gynecologist, and you need to do some other investigation. Scan may be one of the investigation you'll be asked to do, and some other stuff will be asked you. They will ask you, may you do. So when you do all those things, the doctor will finally know what is the cause, and then he will treat you through that line. So never to fear, to fear, never to fear. Yeah, it may not be pregnancy, it may be something else. You never can tell.
Okay. Doctor, I
Dr. Fred.
beg. Oh, I want to ask you a question. Why be say during cold weather I dey urinate often, but heat time I no too dey urinate? This is a very good question. Okay, so you want to respond?
Yeah, it's a normal thing. It's a normal thing to the urinate often during cold weather, and during when you take when you drink water or you take any fluid, the body they lost this fluid in different ways, and the two major ways now through your sweat and through urination. So during dry season, people they sweat more. So if you they sweat more, you no go dey urinate more, so that the body go still maintain the normal amount of water wey e suppose dey inside the body. Then during during rainy season, people no dey sweat too much. So everywhere dey cold, you are not sweating, so you no go lose water through sweat. So the other way to take lose more of this water na to dey urinate, so that your body go still maintain the normal amount of fluid wey e suppose dey the body. So e simply just tell you say your kidney and your body regulation system, dem dey work perfectly, dem dey work very well, and dem dey regulate the number of water wey you dey take, wey dey stay remain for your body, and the number of water wey dey comot for your body. Dr. Fred.
Yeah, thank you. Before we continue, I want to say something again. Every day wey we come online, I dey talk this one. I see a lot of you where they follow me. When I know they listen, and you go get problem with your page. I see somebody carry my video, they use my video, they do commentary. Thank you, but don't do that. The only thing you can do is to share. A lot of people don't understand content creation. I don't want to make it look like, this guy, why you wicked? No, I'm not wicked. Go and learn content creation so that you know go get problem with your page. Some people their page they collect
I think Dr. Fred has don't leave us small. I think so. So if you dey hear me, please just let me know say you dey hear me. Or if you have any other question, you can drop it so that we go answer them.
Okay, am I back? Can you hear me now?
Yes, we can hear you. Welcome back.
What happened? What happened before?
Your network disappear.
Oh, sorry. So I was saying that if you know you are in content creation, you they suffer, you they struggle, you don't know how to go about them, you don't know how to even record your
Content
videos,
creator.
you want to avoid copyright violations and the rest. Get my course. I'm not begging you, no. I'm not desperate. Whether you buy, you no buy, go and learn somewhere else so that you will not suffer. Because if you run into problems, you start calling Dr. Fredostar, help me now, do this. I know I'm very busy. So avoid problems like this and hurry up and get the course. Very, very cheap. Thank you. Let's continue. Um Good evening. Um oh my god. Please, what is the cause of bloating?
Dr. Fred, that's how I answer am.
Sometimes you might eat a certain type of food that is not. Sometimes it might be.
So Dr. Fred doesn't leave us.
Sometimes it might be your gut flora, your gut, like this, your stomach, intestine, and then get what they call normal organisms for there, normal microbial flora. Sometimes they feel over plenty, fit they produce gas. Sometimes too, if it be say maybe you get a problem with that your GIT, where we need to find out. Every time you go dey get gas for your belle. Na things to find out. But if you know say maybe e just started few days ago, it might be what you have eaten. So take fluid, take fruits. You go try help your stomach. Maybe you go also need to go to toilet, take enough water, because even when you go to toilet, all those gas fit comot. And then pay attention to the kind of food wey you dey chop. Sometimes beans can cause you to get gas. People wey dey chop groundnut fit get gas, milk fit cause am, even egg can cause that. So be please, doctor, please, something reddish is coming out from my V. I suspect it is prolapse. What is the cause of it?
So most of the time for prolapse, when prolapse happen, it can be if you don't feel born pikin, if you have prolonged labor, it can cause it can that na one of the major cause of prolapse. That's one of the major cause of prolapse. So or maybe you go push pikin wey dey very big, and pikin wey big,
Dr. Israel,
macrosomia, and you go try push am.
hello.
Yeah, I dey with you.
Okay, I don't know. Can you hear
Dr.
me?
Fredo. Yes, I
Dr.
can hear
Israel,
you. You
hello.
first go offline. Dr. Fred. Try push am.
Hello. Can you hear
Dr.
me?
Fredo. Yes, I
Dr.
can hear
Israel,
you. You
hello.
first go offline.
Oh yeah, please continue. No vex. Continue. My network they fuck up this night. Please continue. No vex.
Okay, so as I was saying, uh, for person when first get when get prolapse, it can when you dey see something red they come out, it may be prolapse as you said. It fit be something else. It fit still not be prolapse. So if na prolapse, it fit be say if you don born, it fit be say you try go push pikin wey big well well, or maybe your labour prolong, e dey there, e no gree progress, and before you go do something else. And sometimes fit just still be say the thing just decide to dey you get short vaginal wall, and so because of that you dey see that one, your be like say it already dey down. So those are some of the few causes. So one thing wey you go do, as far you no first dey see am, you come dey see am, you need to go hospital so that make your doctor help you rearrange am, so that e no go dey prolapse again.
Yes, you have to go to the hospital to confirm wetin e be. Please talk on this. A woman gave birth to her first child, and after that, she find it difficult to take in again. What is the cause?
There's what we call secondary infertility. E fit just be say na secondary infertility na the person get, and some persons dey happen like that. So when the person say notice something like this and e don dey look for pikin, we dey call am secondary infertility. E need to follow through the infertility process, how to treat infertility, and before you know wetin dey happen, if everything being equal, the person can become pregnant again. And just know say e fit no be the woman be the problem, e fit come be the man. And so because you first do test for your sperm yesterday e good, does not mean say tomorrow something no fit happen. Something fit still happen. So if a woman wey don first give birth as e first be, e mean say dis woman don first dey fertile, dey give birth, and now e no fit again. So e mean say something happen. So e say dat two of you need to go to hospital again, go try to find out all the system, the hormone level of your body, the sperm, whether e dey work well, whether e dey, if e enter, whether the one wey enter dey fit produce pikin. You people need to go back and do all those tests, all those investigation again. You need to see a gynecologist to do all that for you. So when you do that, if everything being equal, you can become pregnant. Also, there are other ways of becoming pregnant. If that one not work, there are other ways. So you can also try to look at all those ways, and you can have your child through those means. Dr. Fred.
Okay, we dey try. The questions are plenty. The questions, and the funny thing we say they know they share. Law or blessing, we have answered you. I don't answer you. Doctor, I go do test. They say na malaria, but I don't treat malaria. Now I still dey have headache if I wake up in the morning.
You see the fear the you say that your treatment not complete, or it was not e not treat you well, or two, even when you dey treat yourself, you dey stress yourself so much. So if things like that happen, your headache might just be stress. So you will need to rest and eat more food and drink a lot of water. And you can actually go and retest yourself and be sure that yes, even wetin you take treat yourself, e actually help you. So that if e no help you, you need to restart your treatment. Yeah, you need to start your treatment. And you can actually test yourself for other things, because anything can just be the case, because there are some sickness wey dey mimic malaria, whereas not be malaria. Dr. Fred.
Yeah, thank you. There are some sickness where they mimic malaria, where they look like malaria but not be malaria. And if now you they test yourself, then stop them and let a doctor check you. Because some people go just wake up, carry their body go lab, tell them, I bet test me for malaria. What if your problem no be malaria and something else? Eh? So your name is what? Your name is Momodu. Follow the advice where Dr. Israel give you. Doctor, I tested positive for hepatitis B from two different hospitals. So the doctor asked for hepatitis B panel test. I did the test from two different labs. The result says my liver is fine. However, the other doctor prescribed something for you. Why the other just say I'm okay? What is your medical advice on this?
You know why two of us dey laugh? Because you'll be surprised say two of us get different different talk on this particular thing wey you talk. You know why? Because there are school of thoughts. There are different school of thoughts when it comes to things like this. Yeah, when it comes to things like this. So yes, the first things where they do for you, the hepatitis B, the panel and all that, is very correct. And to check the viral load, to check whether the virus they do anything or whether or not they do anything. Yes, it's very correct. Now the one way go further to prescribe that medication wey prescribe for you, it's just trying to be proactive. It's just trying to be proactive, because that medication not be say e dey treat anything, not dey cure anything. Yeah, what that medication they do is just to prevent anything to happen to your liver. So it's like as I will put it now, it's like a something to keep your liver remaining healthy. It's a multivitamin. It's a liver multivitamin. Yes, I think that's the right word. It's somehow liver multivitamin. So he just decides, okay, let's give the liver some multivitamin to keep the liver continue going very well and all that. Why the other doctor will not do anything? Yes, sometimes some doctor look and say, yeah, the liver does not have any problem. Nothing is wrong with you. You are very healthy. You are very fine. There's no need giving the liver anything, giving the liver more work to do, because even that drug is also the liver that will help to degrade it, to do everything before the drug will come work for the liver. So that person just look and say, there is no need. And the only thing, when the two doctor go always tell you, say, always come back for checkup. So that they'll continue checking you up to find out if anything is happening. So it's two of them are correct in their own way because they are two different school of thought. So they are correct in their own way. For me, I think I will even stand with that, with the doctor will actually not do anything. Yeah, I feel say, okay, let's leave you to go. But it now depends on your what we are saying. If maybe when you go there with one fever or one thing or the other, you dey complain of small thing. Maybe you dey complain of fever, your chest dey burn you, you dey get this, you dey get that. I go wan still give you that medication to protect the liver. You understand? E now depend on what you present with. Na go make me know wetin I go do. Yeah, so
Yeah.
they are correct. um
Thank you, Dr. Israel. You've answered. You've answered. The both of them are correct. Now I beg, questions are plenty, and our time is almost up. So I won't try to respond to this. It says, is soluble fiber supplement absolutely necessary for a diabetic patient? Okay, this question, Ngozi Ebuka, we will not say absolutely necessary for a diabetic. There are different ways a diabetic patient fit get condition. Um, if this person wey get diabetes, e get something wey dey happen to am, the doctor wey dey manage am fit tell am say yes, take supplement. E get one video too wey I go post about this. Remember about supplement and diabetes later, maybe this month or next month. It's not absolutely, not that everybody wey get diabetes must take the fiber supplement. Some people, their lifestyle alone, wetin dem dey chop, dey give them the fiber wetin dem need. Some other people might find it difficult. So it is individual based. There's nothing absolute. Na the way this person be, im own body, dem go say you use am. You, this other one, you no need am. But most times our people dey like copy, 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 copy. Do you understand? And also I go post again about diabetes, about supplements. Get one video I go post later on. I don't know if you want to add anything to that quickly.
well, the absolutely necessary actually change, actually make the thing not that absolutely actually make the thing become force. I remember when we dey do MCQ for exam. When you see that kind of this thing, just even though you no know am, just put force because it can never be absolutely. Can never. So even the management of every disease, every kind of disease, there is no one way to manage every disease. Every disease is sometimes managed based on the client, the patient itself. Yeah. So a patient wey get malaria and e dey very strong, I go give am tablet make e dey go house. A patient wey dey very weak, e no dey fit swallow and na same malaria e get, I go give am injection. I may even admit that kind of patient. You can see na the same malaria dey get, but I treated them two different ways. So na im still be this diabetes. Not because say I get diabetic, I must take supplement. You see the word supplement. That supplement mean say I dey add this thing join wetin I dey take already. So it's not 100, it's not 100%, it's not absolute. Yeah.
Let's go. We are almost out of time. How do you know you have ectopic pregnancy and what is the cause? Now, this video, this question when you asked me, I made a video on ectopic pregnancy. That video has about, I think, 2 million views on Facebook and then some views on YouTube. I don't do video about ectopic pregnancy. I explain them. Most time, you, madam, you might not even know you have ectopic pregnancy. All you go know be say your pregnancy test is positive. That is all you might know. You might not even know anything. The next thing where you feel realize be say something problem fit come dey happen to you later on. So try and look for the video. I take my time to explain them. But because this is a live session and we are very fast, we know fit dey teach you about that. But look for the video on the page and you go see am. Please watch am, watch am, watch am. Um, bleeding ulcer and angina from where to where? Thank God, oh, doctor and double doctor. Thank God, oh, chief. I, I'm still waiting for that comment. Make he explain to us how the relationship between bleeding ulcer and angina. I want to know why that person asked that thing. Is it possible to test positive for hepatitis and later test negative with antibody test? Okay, so you want to respond?
Yeah, it's okay. Do you use antibody test to do the two tests, or now two different tests you do? Yes, it is possible to test positive to hepatitis, hepatitis what, and later test negative. But it now depends on what, from what period to what period. And also still depend on who is doing the test, who did the test before and who is doing it now. And very important. That one is very, very important. It also depend on the wetin they take do the test, the strip when they use take do the test. Because if the strip dey expired, it may give you false results. It may be the false positive or it may be the false negative. Any of them can just be. And so now make if you get result like that, it is good to go to a good lab, and because when you go to good hospital you will get good lab there. So when you go to good hospital, they will give you take tell you to go to good labs where you do those investigations and you will know your correct answer to that.
Yeah, that's a very good one. This is not just, it's not a one answer. That's a very good one. What can I be eating to get strength? And this question, because of time, we are out of time. This question, it did very somehow. What can I be eating to get strength? Wait, you mean say you know they get
Food.
strength? If you want to know what you'll be eating to get strength, then eat food. Eat our normal food. Full stop. Food go give you strength. Abi, you know they chop food at all, or you dey chop food and yet you know they get strength. Then there is something that is wrong with your system that your doctor needs to find out. Not on internet, your doctor. But generally, when you eat food, your body go break down the food to glucose to give you energy. No be by eating this. Eat food, our normal food. I don't know where you are, but our food. Don't be looking for now only this food fit give you energy. Eat your food, your carbohydrates, your protein, um your fat and oils, the balanced diet. So Israel, quickly, time don't they go.
I never talk for that one. Another question.
Let's see. Okay, so we are out of time. I dey try check question. I dey scroll to uh doctor, please, can someone start experiencing menopause at 35? Well, anything is possible. Premature menopause, anything is possible. Very
Yeah,
rare,
that's
it's possible.
premature. That might be premature menopause. But if you need to go and see your doctor, Sha, to confirm if there's any other thing that's actually causing the menopause. But that can be premature menopause.
Okay, let's take this question on TikTok quickly. On TikTok, doctor, my wife is 2 months pregnant, but I haven't registered her for antenatal yet. But she's taking folic acid every day.
Yeah, and that's fine. Thank God your wife is taking folic acid every day. I think it's also it's nice that you register your wife. And yeah, of course it depends on the hospital where you want to register. Some hospital will tell you when they like when they register their patient. But it is good you register your wife as far you know that it's already pregnant. Yeah, it's very good. And kudos to you that your wife is taking folic acid. It's very wonderful. If you add
Yeah,
other supplement join am go your make am sweet well well. But take your wife to register.
yeah. The best advice here: take your wife to register. Some people go tell you say you have to wait until your wife is 12 weeks, 20 weeks. No, no, it's not true. It's not correct. It's not correct. Because there is nowhere they say you must wait till that period of time. It's not correct. So take your wife to the hospital, let her register for antenatal. However, you're also doing the right thing. Thank God say she did on folic acid. But it will be better, it will be better for her to register quickly. Yes. Okay, we are about leaving right now. Dr. Israel, let's see. Ah, God of heaven. The questions are many. I admire you a lot, my role model. My brother, who be the role model? Dr. Israel, my guy, nobody is the role model. Nobody is the standard. Just be you. Do you. Do you understand? If you are on the internet and you want to grow, nobody is the standard. Nobody. Nobody is your standard. You can be better than this person. You can be very unique. Look at yourself, study yourself, and do you. Sure, you get, but it's a nice one. Also, Israel, let's take one more. What is the cause of me coughing strongly and at the same time urinating on myself?
Favor, please just go to the hospital. You fit even get ulcer. Okay, no, not be ulcer. Not be ulcer, but one talk. You fit get
Incontinence, pressure
so
incontinence.
yes, urine incontinent. That na one side. That your cough. You fit get when you say the cough strongly. Uh-huh, uh-huh. And urine incontinence fit still just join. So please go to the hospital so that they will check you. Now, because the urine incontinence, yeah, there are different times. It can just be because of the too much cough and all that. That one pour out. And sometimes the urine incontinence, you feel never know. Normally, you just they come up for your body. So please go to the hospital and make you for better for fit identify why you they cough strongly. Now that one catch my attention for a second.
Okay, now let me say this before we round up. Thank you for this response because a Facebook professor is asking every diabetic patient to incorporate soluble fiber to their daily needs. I'm not here to talk about any professor, but listen carefully. A lot of people get different titles on their names. A lot of people get different titles. Um, and whenever we come online, we always make you understand that we have our license. Like I'm using myself, Dr. Israel, and any medical doctor you see on this platform with license, worked for it, and we are not ashamed to let you know. So be very careful. Even when we give you advice on this platform, we dey also tell you to discuss with your doctor. We know the fear talk am. Like you can take us anywhere in the world, especially if you go pay our flights to defend ourselves. We are ready. We know they hide. That's why we dey engage you every day. So be careful the advice you take on the internet. Even when we give you advice, we dey also tell you say discuss this with your doctor. Go to the hospital so that your doctor go check you. No be say you go just everybody follow. Make you no go take advice wey go damage you and then you pay the price. So be very, very careful. Some people are calling themselves doctors and they no go medical school. They just they are not medical doctors, but they love the title. These are not PhD holders, oh, those ones are different. PhD holders are academic doctors, but these ones call themselves doctors. They are not medical doctors, and they try to treat you and attend to you as if they are medical doctors. Be careful. Dr. Israel, any final words as we disappear?
Okay, yeah, my final word is just to say please make we dey very careful with whatever we dey receive from the internet, any part of the internet, Facebook, TikTok, Instagram, X, and all of that. Let's be very careful what we receive. And every information wey you get, please verify the information. Whether they come from us, whether they come from any other medical personnel, whether they come from anybody, please verify the information. It is very important you verify the information because na that one you take know whether these persons dey talk the right thing or these persons dey talk the wrong thing. Even the Bible talk am, e get one set of people, one set of children wey dey Bible where the Bible talk say when they don teach them finish, these people go come still go, they come go look am whether wetin dem teach them correct. So that is what we want make una dey do. And so that you guys will understand and you will learn. With that, you will learn very well. So thank you so much for following us. Thank you so much for listening to when you take the listen to us every day or when you take the listen to us every Sunday as well by 8 p.m. to 9 p.m. We not take you for granted. We say thank you so much. Thank you so much. Dr. Fred, I not go stop telling you thank you for always remembering to start the life. Thank you. Thank you.
Yeah, thank you, Dr. Israel. Thank you so much. For those who they watch us for the first time, this program now
Yeah,
every
double
Sunday.
doctor don't say something, not be lie. Oh. Sorry, Dr. Fred. Double doctor say something, not be lie. Not use Google or AI. I beg. Go meet your doctor. Go meet your doctor where they treat you and make those verifications. Thank you, double
Yeah,
doctor.
yeah, thank you for that. Thank you for I know what to talk. So this program, I beg, listen, I beg. For the new people where they watch, now every Sunday by 8 p.m. to 9 p.m. We don't they do and they come. Maybe today we start. We don't they do and they come for a very long time, or more than 5 years. So no vex, say we not answer you. We be human being like you. Thank you for watching. Thank you for listening. We try our best to engage with you, and everything will be the talk evidence based. No be say we just wake up, just hear from one side. Evidence dey to back am up. I beg you, I beg you in the name of God. Your health is important. No go lose guard. Carry anything you see and take. We no dey here to private chat you. We no dey here to give you number. We no dey find line. Major reason why we are here is to teach you. We no dey there with your doctor. Have a doctor you can speak with. E dey very important. And finally, if you be content creator and you never get my course, you never learn anything about content creation. If you post my video on your page and you enter problem, is on go and learn. Avoid problems in creating content. My course will help you. It's cheap. This one you go pay. This one is not medical. This one you go pay. But if you no want buy my course, get it somewhere else. I beg, so that you no go suffer online. Remember, good life now waiting. Good life, good life, na sense. We'll see you next week Sunday on this platform. Take care and have a wonderful evening. Bye bye. Bye bye.